In this video, we will learn what bipolar disorder is. We'll talk about the possible causes and symptoms that people can experience. We'll also look at the current treatments and strategies that you can use to keep well, and hear from Rachel, who shares her story on living well with bipolar. So what is bipolar disorder? Bipolar disorder usually starts during or after the teenage years, and it's uncommon for it to start after the age of 40. About 1 in every 100 adults could have bipolar disorder at some point in their life, and men and women are affected equally. Bipolar disorder is a condition that causes serious shifts in mood, energy, thinking and behaviour, from the highs of mania on the one extreme to the lows of depression on the other. People can use different terms for bipolar disorder, such as bipolar affective disorder or manic depression. As with some other mental health conditions, research is still ongoing into the cause of bipolar disorder. But according to the Royal College of Psychiatrists, bipolar disorder runs in families. It seems to have more to do with genes than upbringing. There may be physical problems with the brain which can control our moods. This may be why bipolar can often be controlled with medication. It's also thought that episodes can sometimes be brought on by stressful events or physical illness. As I mentioned in the previous slide, bipolar disorder is a shift or fluctuation in mood between mania or highs and depression or lows. People may notice that their mood changes may have a cyclical pattern where they become high or low over a period of time before their mood returns to normal. The cycles of bipolar disorder can last for days, weeks or months and can be so intense that they interfere with a person's ability to function. Depending on the frequency and intensity of the mood changes, your doctor may discuss different types of bipolar, such as bipolar type 1, bipolar type 2 or cyclothymia. People with bipolar disorder can experience varying degrees of depression or mania. Symptoms of mania include feeling very happy or excited, feeling irritated with others, feeling more important, feeling more confident, feeling full of exciting or creative ideas, having racing thoughts and finding that you need very little sleep, being highly distractible, having difficulty concentrating, talking rapidly, and acting recklessly, impulsively, or being less inhibited. The symptoms of depression include feeling a low mood or unhappiness, having a loss of interest in things that you normally enjoy, feeling unable to enjoy things or feel pleasure, feeling useless or hopeless, feeling tired all the time and not having any energy, noticing changes in your appetite or weight changes, difficulties in sleep such as waking up very early in the morning or waking frequently throughout the night, having poor concentration or memory. Perhaps you may have feelings of worthlessness or guilt, or thoughts that life isn't worth living anymore, or suicide. People with depression very often become socially withdrawn from others. So how can we recover and keep well after an episode of bipolar disorder? Your doctor will be able to refer you to a mental health team who will discuss your condition and the treatment options with you. The aims of treatment will be to help manage any symptoms that you're having and to lessen the impact that they have on your life. It's also very important that we learn more about our condition and find ways to keep ourselves well. In some cases, people may need to go into hospital for assessment or to help keep them safe. However, most people can get the help that they need at home. Medication can be helpful depending on the symptoms that are present at the time. Antipsychotic medications such as quetiapine or olanzapine can help during a manic phase when people may experience unusual beliefs. These can help bring the mood back to normal. Mood stabilizer medications are another type of medicine that are commonly used to help balance the mood and manage further mood swings. Lithium is an example of this. Antidepressant medications such as fluoxetine could be used when depression is the main feature. Your doctor or psychiatrist will be able to explain the best type of medicine for your symptoms and may combine different types of medications to get the best results for you. It may be necessary to have your physical health monitored when taking some of these medications. It's also important that you don't suddenly stop any medication when you feel well, unless you discuss this with your doctor or health worker first. Medications can be helpful as a start, but they're best combined with other types of therapy, which can help people learn how to manage their mood changes. Talking therapies can be helpful for the individual and their family find ways of coping with their condition. CBT, or cognitive behavioural therapy, is a talking therapy which helps us understand the links between our thoughts, our feelings and our behaviours, and learn coping strategies to deal with these. Family work is another type of talking therapy that involves the whole family. It focuses on reducing stress within the family and finding ways to communicate better and solve problems. Family work has shown to help people with bipolar disorder stay well for longer. Speaking with a mental health professional or friend can help you reflect on early warning signs. These are the changes in your emotions, thoughts or behaviours in the weeks, days prior to an episode. Making a list of these and developing an action plan can help identify an episode early and stop it from escalating. This can also help you feel more in control. As I mentioned in previous slides, stress can be a trigger to changes in our mood. Unfortunately, we can't avoid all life stressors, but there is a lot that we can do to look after our mental health and keep well. Maintain a structure. Try to set some tasks for yourself on a daily basis. This can help with motivation when your mood's low and promote your self-esteem. Eating a healthy diet is very important. This can help maintain good energy levels, and it's also important to reduce your caffeine or stimulants, particularly if your mood's high. Try to get enough sleep. Sleep gives our brains a break, and this can help us think more clearly. Good sleep hygiene is going to bed at the same time and avoiding daytime naps. This helps promote a regular sleep pattern. It's also important to monitor any changes in sleep, as this can be an early sign of mood changes. Being outside in a green space can be very therapeutic. Try to do practical things, activities that can help keep us focused or distracted from other worrying thoughts. Perhaps learn a new skill that can boost self-esteem and help us stay connected with others. Relaxation, yoga or mindfulness are all very good at helping manage stress and anxiety. Practicing these techniques regularly can help us manage the mental and physical effects of anxiety and stress. There are lots of online resources to help learn relaxation and mindfulness, and there's also a Recovery College workshop on mindfulness. A mood diary is a helpful tool that can help us keep track of our mood. It could record hours of sleep, physical health, activity, energy, or any indicators of mood changes that are unique to us. It can help us reflect on the effects of life changes or any stressors or lifestyle factors such as alcohol or exercise and the effect that it has on our mood. It's a useful tool in helping us identify some of the early warning signs and take control over our condition. A RAP plan is another tool which can help us identify our unique toolbox of strategies that we use on a daily basis to keep well. A RAP plan or Wellness Recovery Action Plan can be completed with family or friends that you may want involved in your wellness plan and recovery.
Hi, my name's Rachel, and I'm here to talk to you today about my life experience living with bipolar disorder. I would say my bipolar started in my teens, but I've had a diagnosis for the last 10 years. Initially, I was diagnosed with anxiety, then depression, then obsessive compulsive disorder, then a mood disorder. It was then said to be rapid cycling bipolar type 2, and eventually my illness progressed to bipolar type 1 with psychotic features. I had a lengthy period of instability with extremes of mania lasting days to weeks, which featured poor sleep, risky situations, overspending, racing thoughts, and rapid speech. Following this always came the low or depression, lasting from days to months, featuring crying excessively, anxiety, poor sleep, overeating, agitation, memory, concentration problems, feeling numb, worthless, and exhausted. After numerous medications, I found a combination that started to work primarily with lithium. I actually kept my illness hidden for many years from friends, colleagues, and extended family until my last episode in 2016, which lasted almost 1.5 years. From this episode, I finally found what has got me well and kept me well, which was acceptance. I finally figured out that bipolar did not own me. It was an illness, not an identity, and I was determined to take back control. My mum found a book online by Julia A. Fast called Bipolar Happens, and I have read this now numerous times and I still read it today. I used it to educate my family, friends, and partner on bipolar and how it affects me as well. The biggest thing I found that helped was reading. I did a lot of research around bipolar, mania, depression, and the bits in between, what some people would call feeling normal. I feel arming myself with information about the triggers, early warning signs, and relapse prevention has helped with my stability. During this recovery, I made a lot of life decisions for myself and recovery. I left what was a very stressful job and through myself researching my condition, finally began to say the words that I have bipolar and began confiding in friends, family, and I ultimately then gained enormous support. I got involved with the Recovery College, and after some courses, I began helping others through co-facilitating and educating others on ways to help recovery. There has been some dark times, but once I feel that we keep hope and surround ourselves with people who instill hope in our recovery is always possible. Um, for me, managing anxiety would mostly be using exercise, mainly walking. Eating healthy and limiting alcohol also helps with the depression side of things. Um, I feel that self awareness helps me greatly. I'm now finally aware of my triggers and I try to avoid stressful situations where possible when I can. I usually am aware of when I'm becoming unwell and I'm able to talk to somebody that I can trust or contact the mental health team or GP and get help sooner rather than later. I find that I need to take my medications daily as prescribed to remain stable. I've been stable now for nearly 3 years and I have great faith in recovery. I know with my type of illness I may relapse in the future, but I've accepted my illness and I now know that I have a good support system and I'm aware of my own responsibilities for keeping myself well. I have hope that I will always have recovery and it is achievable. I'm the happiest now I have been in 20 years and have a good life, even with my diagnosis of bipolar.
The Recovery College has co-produced a number of short video presentations on different mental health and well-being topics. Please watch them on the Recovery College page on the Western Health and Social Care Trust website or on the Western Health and Social Care Trust YouTube channel. You can also enrol at the Western Health and Social Care Trust Recovery College for one of our group workshops on the Western Health and Social Care Trust website. If this video has raised any issues for you and you require support with your mental health and already have a key worker, please get in touch with them. Otherwise, you could make contact with your GP. Alternatively, you can telephone Lifeline or the Samaritans who both offer 24-hour, 7 days a week helplines. Thank you for watching our video.